So on behalf of NIOSH Future of Work Initiative, thank you for joining us for today's webinar, The Role of Work Arrangement in the Future of Work. That's the title. And my name is Tapas Ray, and I will be your moderator today. Before we get started, I would like to let all our attendees know about the NIOSH Future of Work Initiative, which was launched in 2019, and it's a corresponding work group. Its corresponding work group have many ongoing and upcoming activities. In 2021, the initiative launched its webinar series, and today is the 8th webinar that we are having in that series. 3 webinars a year are usually hosted, and each focuses on one of the 9 future of work priority topics. And the priority topics are here at the bottom of the slide on the right side, right and bottom. If you'd like to learn more about the series and the initiatives, then please visit our website. As I mentioned before, I am the moderator, and we have 2 excellent presenters today with us. I will just go ahead and introduce you to your 2 speakers today. Renee, who is the first one to go. Renee Panacrine is the Chief Economist and Director of the Economic Research and Support Office in the Office of the Director of NIOSH. She also co-manages the NIOSH Healthy Work Design and Worker Wellbeing Cross-Sector Program. Her current interests include understanding how to improve the design of work, management practices, and the physical and psychosocial work environment in order to enable workers to thrive and contribute productively at work, at home, and in the society. So Renee joined NIOSH in 1996 as a postdoctoral prevention effectiveness fellow. And after Renee, we will have Dr. Ed Yellen. So Edward Yellen is the Edward Edkinson Emeritus Professor at the University of California at San Francisco and the Principal Investigator of the California Labor Laboratory, a NIOSH Total Worker Health Center of Excellency. His research has focused on the relationship between work and health, both the impact of the organization of work and on the health of the working age population, and how persons with health problems can maneuver through the thicket of contemporary employment. The research on how persons with health problems can successfully navigate employment concerns, how the shift from a manufacturing to the services economy, and from a labor market in which most workers were formally hired by the firm for which the work is done, to one in which alternative forms of employment become the norm, as well as how variations in working conditions affect employment outcomes. Dr. Yellen has won numerous awards for his research and is an elected member of the National Academy of Science. So with that, I will welcome both of you. And I will just open up for Renee to share her slides and take control from here.
Thank you. Okay, welcome everybody. I'm gonna go forward with this portion of the webinar. So Tapas already showed you the list of priority topics. One of them is work arrangement, but there are many others that affect work arrangements, interact with work arrangements, including, of course, technology and demographics, economic security, etc. So work arrangements are important determinants of worker safety, health, and well-being. And we have to understand the detailed aspects of its arrangement and how this may change in the future. Next. Thank you. Okay, so this is the overview. So first, I'm going to talk to you about the elements of work arrangements and related concepts, such as contingent work, work precariousness, and work flexibility. I will also talk about the alignment of these elements with or characteristics with job quality elements, for example, co-employment, benefits, and work schedule. I will tell you about a recent conceptual work design frameworks and initiatives by both NIOSH and others that specify job quality elements as well as their determinants and outcomes. I provide just a few summary examples of the evidence of the association of these aligned elements with worker well-being, and some very few examples of knowledge and measurement gaps. Next slide, please. So first, the elements of work arrangements and related concept. Next slide. So we don't have commonly accepted definitions of so-called traditional or standard and non-standard, also referred to alternative work arrangements. And this affects our ability to collect data that accurately assesses their prevalence and can be used to derive worker well-being research findings. So we provide an overview of a two-tiered approach to classify work arrangements. The first one is a legal approach to classify employed, co-employed, and non-employed workers. And the second tier approach is based on important characteristics of all work arrangements that vary by arrangement. So this would be pay level and security, benefits, job security, and work schedule. And the focus usually is on the main job because that's how we collect data usually. Next slide. So to elaborate on the legal approach, I wanted to mention that the standard arrangement means that the employer controls the manner and means by which the worker provides services and is responsible for the safety and health of employees. And types of other arrangements, the so-called non-standard ones, include agency, so those who are co-employed. And this means that there is a shared responsibility for workers among employers. Contract, which is a business rather than employment relationship, and gig arrangements. And here we mean intermediated by digital online platforms. So an example of a household survey using such an approach to classify workers is the Contingent Worker Supplement of the Bureau of Labor Statistics, BLS. And so CWS defines as non-standard, and they call them alternative arrangements, temporary help agency workers, so this will be your agency workers, workers provided by contract firms, independent contractors, and on-call workers. The on-call workers are in italics because I'm going to tell you a little bit of a story about those. Next slide. So there was an effort by the National Academies of Science, the National Academies, in 2020 to delve into the details of how data are collected and how to do a better job collecting data and understanding the important details about work arrangements. So the National Academies urged us to understand what it is that we're collecting right now. So the CWS includes questions about self-employment and obtaining customers on one's own. So if we use the information collected in CWS, we can come up with mutually exclusive categories, not including on-call workers, that the National Academy says should be classified in the second tier because on-call work relates to work schedules. So back to the mutually exclusive categories, we can understand, who are employees, not in a non-standard work arrangement, who are the workers in intermediated or co-employment arrangements, including the temporary agency workers that I already told you about, and the contract firm workers other than agency workers, to distinguish among the two categories of the employed. That's what this is about. And then two more categories are those who are not employees or are self-employed, including independent contractors, and those who are self-employed but not independent contractors. Again, the National Academy is giving us a way to understand more about this category of workers that are mutually exclusive. So also, the on-demand or gig work is a hybrid of work by contract firm workers and independent contractors. So we need to distinguish between gig workers who are W-2 employees, this is how they file their taxes, and gig workers who are in self-employment or non-employee arrangements. Next slide. So here I'm going to mention a couple of other surveys beyond CWS. and the second tier classification approach. So I will talk about this a lot, the General Social Survey and its quality of work life supplement that is partially supported by NIOSH, and also the National Health Interview Survey and its occupational safety and health supplement. So those two surveys use a single question, have been using a single question. And so basically it's a question that says, are you one of those? Temporary help agency workers, contract firm workers, independent contractors, or on-call workers. And then of course it includes an option to check as being a worker in a standard arrangement. So that's how they assess the arrangement according to the legal approach. So these surveys collect data on worker well-being and work characteristics in standard and non-standard arrangements that are important determinants of worker well-being and included in the second tier classification approach. Next slide. So now I'm going to tell you I'm going to tell you a little bit about related concepts that are very intermingled, with work arrangements. So one of these concepts is contingent worker. So back to CWS, there are 3 definitions on that. And so I'm only going to focus right now here on workers who don't expect the jobs to last. There are 3 different definitions. BLS presents those, and you can use either one, either one of the 3. But the broadest one is the one that I mentioned. Don't expect their jobs to last. Then there is work precariousness, which is another, of course, concept that doesn't have a standardized definition. But its characteristics include insecurity, temporariness, vulnerability, lack of ability to negotiate pay, benefits, and work schedule, lack of ability to take leave, and lack of a social safety net that would include unemployment and workers' compensation insurance. By the way, the references are included. If I don't provide the links on the slides, the references at the end of the slide deck. And then another related concept, in addition to the contingent work and the work precariousness, a related concept to work arrangements is work flexibility. This is one example of work organization practices that are changing over time and can affect worker well-being. Again, we don't have a standardized definition, but common types of flexibility include working at home, taking home off when needed, and changing one's schedule. Next slide. So it's important to remember that while most of the data that we have is about the first job, the main job of workers, it will be important for us to understand what happens with all the jobs, in how the worker is affected by all the jobs the worker might be doing. And here I included one reference for the actually administrative data set by the US Census Bureau. And you can read more about this using the reference that I have provided. Also, I wanted to mention that it's important to understand all the jobs held within a household. Again, the national academies, we've said it, many others have said it, the National Academy said it in the report from 2020. Because access to benefits by one household member might also enable access to benefits by another household member. For example, access to health insurance. Next slide. Now I'm going to transition to the NIOSH Healthy Work Design and Wellbeing Framework to talk about these elements that have to do with healthy work design and are aligned with the stories that I just told you about work arrangements and the related concepts. Next slide. So this is a very simple sort of schematic here to talk to you a little bit about the healthy work design categories of outcomes that we consider. So basically, they're very broad. There are 4 sort of broad categories. The work-related proximal is what we call them. So those would include the stress, sleep, fatigue, and mood. The safety and health, which are your traditional metrics of injury and illness. The economic ones that include dollar-based metrics, but also health-related quality of life metrics, and as well as disability-adjusted life or life years metrics. And then in the category of other well-being, we have included hedonic metrics of well-being. So, for example, do you feel happy? Do you feel angry? And evaluative metrics. So, for example, people can be asked about the current and expected, anticipated future life evaluation. So, of course, every category might be affected, each category can be affected by other categories, and those are not linearly related. Next slide. And here I'm showing you this because I want to stress that there are determinants for work design. In other words, what's happening at the organizational level, how is work designed, and market and societal determinants, broadly speaking, affect work design at the organizational level, and of course then that has consequences for worker well-being and other outcomes. Now, I wanted to say that we're aware that the market and societal determinants can directly affect worker well-being, but we're more interested, because I'm telling you about the framework, we're more interested on how these broad determinants affect work design and how that then affects the worker. Next slide. So I'm trying to be concise here. So I'm not going to delve into this market and social determinants. This could easily be a book. But I just wanted to mention, again, important and topics that, we've heard before, like for the future work topics, right? The technology options, that work design is influenced by the technology options available. There's something to do with the labor market, the costs to employ workers or use workers, the characteristics of the labor market and the preferences of workers. Regulation and incentives are important concepts to understand so that we can better understand the determinants of work design, etc. Next slide. So this is kind of the slide that we use as sort of the summary of the important elements of healthy work design. So you can see here again the sort of overlap of elements with the story I told you before this section. About work arrangements, about the related concepts to work arrangements. So, for example, we have evidence that direct employment overall, not always, might be better for the well-being of workers versus contracting, but those are not absolutely true. These relationships are nuanced. Another element of healthy work design is the selection and recruitment of workers. So we're very interested in job worker fit. We're very interested in job security, satisfactory pay and benefits, reasonable workload, fairness on many topics, fairness associated with many issues at work, opportunities to exercise skill and practice, participate in decision-making, recognition, training and career ladders, very importantly, paid leave and work-life fit programs and policies that include adequate schedule flexibility and predictability. And of course, we're interested in health protection and promotion and, facilities and locations that support worker well-being. Next slide. So now I'm going to tell you about another framework. And there are more out there that we have discovered. And we have been aware for a while, actually, but I want to mention this one because it's sort of a more recent one and it's comprehensive. And we also like their overlap with what we are talking about and they have great measurement guidance that I will tell you a little bit later about. So this is work by efforts by the Department of Labor, the Department of Commerce, and their partners. And I'm here talking about these good jobs principles. Next slide. So here I provide 2 links for you to check out about a good job summit that was hosted by the Department of Labor and the Families and Workers Fund that I will tell you also later. So this was a conversation on how the federal government is administering and prioritizing the creation of good jobs through federal infrastructure investments. And then you can also check out the good jobs principles, and I provided the link for that. Next slide. So here's examples. I have 3 slides with basically the categories or buckets of the good jobs principles. And I'm gonna walk you quickly through those, but you already heard many of those, right? Recruitment and hiring, the pay issue, the benefits, and including things that workers should be empowered and encouraged to use these benefits, not just to have access to, but you can actually, realistically, practically be using them. Next slide. So a big category here is diversity, equity, inclusion, and accessibility. So, the second bullet, for example, talks about respect and empowerment and fair treatment, and, making sure that diversity, equity, inclusion, accessibility is a core value, and it's a practice norm in the workplace. So again, the next category, empowerment and representation, it does assess the ability to join unions. Workers should be able to engage in activities without fear of retaliation, etc. Next slide. And here is a big bucket, a big category of job security and working conditions. Again, for example, workers are properly classified under applicable laws. This is the one before the last bullet in this category. So we know that sometimes workers are intentionally misclassified. So we want to, make sure that that doesn't happen. You can see again here, just like you saw at the Healthy Work Design Framework, that temporary or contractual labor solutions are minimized because we have evidence overall. Usually we have evidence that those workers fare worse than the workers in standard arrangements in, one employer kind of relationship. Organizational culture, again, all workers belong, they are valued, they contribute meaningfully to the organization, they're engaged and respected. And then skills and career advancement. Next slide, please. So now I'm going to transition to the summary examples of the evidence of the association of these aligned elements I was talking about with worker well-being. Next slide. So I'm going to say that for those slides, for those studies, you have the links and you can go look at the studies, because I'm not going to be very fair here, and I have to run you through the slides just to give you some examples. So this study is about work arrangement and health-related quality of life. It used quality of working life data, and consider work arrangements the main job, of course, and healthy days. And healthy days are those during which in the last 3 days, how many days in the last 30 days did the respondent feel like they were in poor physical and mental health? Those days are added, and that's what the metric of unhealthy days is. And of course, days with unlimited activity limitations do health problems. So, so the study examined the association of work arrangement with a variety of organizational and other core characteristics. And the study concluded that occupation, industry, hours of work, and shift type, part of full-time status were significantly associated with work arrangement. Next slide. So here I'm just going to mention this one metric, right? So work arrangement and its association with stress, right? So you can see that in this particular study, and with the numbers that we had, independent contractors and on-call workers were less stressed. That's what is the significant than workers in standard work arrangements. That's the one. These are the two significant relationships that we were able to identify. Next slide. And here you look, we're looking at the ones who are stressed. Okay, so stressed workers only on this slide, those who reported they're stressed. So you can see that independent contractors who said they were stressed were reporting more. They were more likely to report unhealthy days. And also you can see that workers in standard arrangements reported, more or higher number of unhealthy days. So that's interesting because we have to remember that just because workers are in standard arrangements doesn't mean that they always fare better than workers in other categories. So all of this is nuance. That's what I'm saying. That's my thread here. And then you see other relationships associated with activity limitations due to health problems. So you can see that here, agency workers who were stressed, fared worse, and standard, again, workers who were in standard arrangements fared worse. These were the significant outcomes that we were able to identify. Next slide. Then, this study that, again, I'm not going to do full justice because I have to rush through the slides, work precariousness, job stress, and health-related quality of life. This study constructed a work precariousness scale that included buckets of temporariness, disempowerment, vulnerability, and wages. So then the authors kind of used the first, the lowest scores of the scale to call them low precariousness. The middle third of the scores were medium precariousness, and the top 1/3 were high precariousness. And so there was, the authors found significant positive association between job stress and work precariousness. And so the workers reporting work precariousness were more likely to experience more unhealthy days and more days with activity limitations, total health problems. Next slide. Here, this slide very quickly, I'm just showing to you because you can see that a higher percentage of females reported moderate or high precariousness. Next slide. And here you can see that those who were at the high work precariousness category had a higher, as expected, probably, reported more job stress, more unhealthy days, and more days with activity limitations. And those were significant, statistically significant. Next slide. And finally, here's a slide about work flexibility and work-related well-being. Again, these are complicated relationships. Some are expected and some are not. Here, in the interest of time, I'm gonna only look at the indicator of flexibility work at home and the job stress and the job satisfaction columns. So you can see that those who work at home report both higher job stress than those who do not, and higher job satisfaction. So again, the point here is that we want to understand the details. We want to understand all the jobs. We want to understand all the jobs in the household, etc. But these are complicated relationships. That's the story. Next slide. So here again, very quickly, I'll tell you about knowledge and measurement gaps. Next slide. So what is NIOSH doing? This is a slide about what NIOSH was doing with others, of course. So we have the program, the Healthy Work Design and Wellbeing cross-sector program, has both sort of inside-looking and outside-looking activities with partners. The outside-looking part, the council, and of course there's the Future of Work initiative, and all of these three kind of groups that I told you about have developed strategic plans, strategic goals. So work arrangements and related concepts are important parts of these strategic plans. They are priority areas. And then we were fortunate to receive funding, and actually slides should not say currently being collected, but it has been collected, data by the National Health Interview Survey that asks about this business about, does your employer deduct or withhold taxes from pay? This would be the question about the W-2 form. And other concepts that we've been talking about, right? Month-to-month changes in earnings, usual shift, frequency of changes in work schedule on the part of supervisors. In other words, not under the control of workers, but what the supervisors do. Advanced knowledge of schedule and likelihood of losing one's job in the next year. So information from this data collection can guide data collection by other surveys. Next slide. And some more gaps, right? Improved surveillance methods. We need better surveillance methods to include emerging determinants of well-being, like flexibility, We want to know which job elements matter more for which workers. We want to understand better the effects of evolving advanced technologies and worker demographics. So, I mean, the remote work partially is possible because of, technological advancement, but that's not obviously the only technology we're worried about. Again, we talked about, one thing that I'm not sure that I said out loud, that we want to understand the experience of the worker over the span of a working life, considering all the jobs held simultaneously, the sequence of jobs and periods of unemployment. We want to understand the barriers and aids to implementing cost-effective safety and health programs for workers in non-standard arrangements, assess the cost and comparative effectiveness of programs and trainings, to improve the well-being of workers in non-standard arrangements. We want to understand overlapping vulnerabilities experienced by workers in specific demographic groups. And we want to conduct system research and understand macro-level external factors such as economic conditions or changes in temperatures, for example. Next slide. And my last slides have to do with the Families and Workers Fund with Partners work that I was telling about. And I have 3 slides that I think I'm going to skip right now in the interest of time. But you can see in their, I think, very excellent report on the measurement report, you can see how they have identified the needs, the gaps. And they also go further by suggesting what entity should pursue what gap. For example, the federal government or state and local governments or charity organizations. So this is very well done. And I urge you all to go and check it out and look at the rest of the slides that I have included that include references and a little more information about outcomes on the prevalence of work arrangements. So I'm going to stop now and transition to let's transition to Ed Yellen's slides. Thank you very much.
Thank you, Renee. And I will request a remote control, and hopefully this will work, and I can advance the slides. Yes, so I will advance to our slides. And you'll see that there's a tremendous amount of overlap between what Renee just showed and what we're doing. Whoop. So I'd like to start by saying this is the first presentation of results from the new California Work and Health Survey, which is being done as part of our Total Worker Health Center of Excellence, for which I thank my NIOSH colleagues for their generous support. Title of my talk is Prevalence Impact of Alternative Contingent and App-Based Employment, and Renee made the distinctions among those kinds of work. And these are results from the new California Work and Health Survey. I'd like to also mention my colleagues, Laura Trupin, Nari Ree, Alicia LaFrance, Tricia Eiley, and Imam Fargessa Mack, any of whom could give this talk as well as I could. It's a standard disclaimer from the Total Worker Health Program, which I will pass on. Renee talked about this as well, the National Academy of Sciences 2020 report on measuring alternative employment. Some of the issues that they raised were the reference period for employment questions, with the note that much alternative work is done episodically. Much alternative work concerns secondary, not main jobs. There's confusion about contract employment. The usual question asks about procuring one's own work when some people work as a contractor from one employer long-term. That's especially common here in the Bay Area and Silicon Valley. There are some confusions about what self-employment is, particularly among those who are small business owners. Issues about day labor, shift work, on-call labor, as Renee talked, and regularity. And then there's questions about the validity of items about contingent work that are dependent on expectations of continuity. Somebody once said, we're all contingent in the sense that we could lose our job at any point. So the aims of the California Work and Health Survey were to expand the scope of inquiry about employment to include a greater number of jobs, including secondary jobs, and those worked in the past month, noting that the Bureau of Labor Statistics standard questions ask about the week prior to interview. Improve items related to emergent working conditions and potential misclassification of workers. Document the prevalence and impact of alternative contingent employment, especially for marginalized workers. And now I'm going to turn to the survey itself. So in the questionnaire development process, we wanted to better characterize the emergent workforce in the current California economy. And to do so, we had consultation with labor market experts and interviews with key informants in selected industries: rideshare, warehousing, janitorial, restaurants, tech, and day laborers. And new items were developed and tested subsequently using cognitive interviewing techniques. And I'd like to, at this point, especially call out Alicia LaFrance and Ima Vargesa-Mack, who worked on this phase to a greater extent than the rest of us, and I thank them. So in the content of the survey, and I'm quickly summarizing it here, on the employment side, we collected information on main and second jobs in both the week and month prior to interview, and a lot of other things as well. Health status using standardized measures, demographic and economic circumstance, where we collected information on income and earnings by category, benefit recipiency, and the respondents' assessment of the adequacy of their income. In terms of the sampling, we did a random digit dial sample of cell phone numbers, including regular that most middle-class people have, and prepaid plans, which are more common among those of lower income. The sampling frame covers 98% of the target population in California, and it's been quite a revelation for those of us who do work on disadvantaged members of the California community that virtually everyone in California has a cell phone. We completed our survey among 4,014 California adults aged 18 to 70. We want to expand beyond the normal age of 65, working age of 65, because of the need for a lot of Californians, given the cost of living, to work beyond that. And we excluded me because I'm 72. We conducted the survey between November 2022 and April of 2023. The surveys were completed by telephone interview or a self-administered web platform, but I want to emphasize that everybody was sampled the same way through the random digit dial of cell phones. And the results that I'm reporting here were weighted to the California population. So, and I talked about this as well, the BLS has defined alternative work as including independent contractors, both those who are self-employed and those who work for someone else as an independent contractor. Some people use the term wage or salary independent contractors. On-call workers, people who are being paid by a temporary agency, and those whose employment is subcontracted out. Very common in California. In Silicon Valley, for instance, not only could a programmer be working for another company, but clearly all of the people who clean the offices or provide the food service work for other firms. And I also went through this. I won't dwell on it. The BLS has 3 definitions of contingent work, each of which we used. We also asked about jobs secured through an app, a separate concept from alternative contingent jobs. And here again, I'm just reflecting what Renee said earlier. So when all was said and done and we interviewed these 4,000 plus California working age individuals, we had a very large increased yield from extending the time frame of data collection from the week prior to interview, which we also asked about, and also asked about the past month, and the scope of the questions from main to second jobs. When we increased the time frame from a week to a month, we increased by 6% the number of people identified as working. In terms of the different kinds of employment, for independent contractors, the combination of increasing the time frame and the scope increased the number of people identified as independent contractors by 28%. For all forms of alternative work by 35%. For contingent forms of employment by 46%, and by app-based employment by 42%. So the bottom line is, by extending the time frame and the scope, we vastly increased the number of people identified in these different forms of employment, even though the proportion of people identified as employed only increased by 6%. So summarizing the overall data on employment status of the approximately 27 million Californians 18 to 70 during the week, month, and year prior to interview and ever, we identified 72% who were in the labor force in the prior week. About 67% were actually working in that week. 71% were working in the month prior to interview, 80% had worked at some point in the prior year, and 98% had worked at some point in their working lives. 78% of Californians reported to us they had one job. 15% had two jobs, and 7% had three or more jobs. I should point out that among the 7%, some had as many as 8 or 9 jobs, quite astounding. But what's interesting is a minority of working age Californians work full-time for the full year, 45%, more than a fifth, and up here in the upper quadrant between 9 and 12 on the clock, so to speak, work part-time for only part of the year. So in California, and I think probably in many other places in the country, a minority work full-time full year. But here I show the percent of people working less than full-time or greater than full-time in the year prior to interview. So about a third work full-time. 44% of those who are employed in the prior year work less than full-time, and 22% work greater than full-time, and some of them work as much as an average of 80 or more hours a week. In the bottom left side, we defined what we meant by full-time labor, either 35 weeks times 35 hours per week times 47 weeks through 40 hours a week times 52 weeks in that interval and greater. But even given the up to 80 hours to define full-time work, still 22% worked more than that over the course of the year. So here I begin to show some of the data on alternative forms of employment. On the left side are the two bars showing the proportion of workers who reported in their main job in the past 7 job days, or any job over the 30 days. So up to a third of workers, over a third of workers had some form of alternative work. In the next 3 sets of bars, we show the data for those in independent contracting, those who are self-employed, 15% in any job in the past 30 days, what are called wage and salary independent contractors, 7% in that same time frame. And when you summarize all of them, 21% were independent contractors at any point in any job in the past 30 days. The proportions who were employed by a temporary agency was much smaller, on-call workers the same, and subcontracted work up to 12% of workers. When we look at the definition of contingent and app-based work in the main job and any job in the past 30 days, main job in the past 7 jobs, in any job in the past 30 days, about 7% of workers held contingent work in the low and middle estimates, and which Renee had also mentioned. When for the higher estimate, which just requires the worker to perceive their job as impermanent, up to 12% of workers in the past, any job in the past 30 days had contingent work. In terms of app-based employment, people who secured their work through an app, for 7 days, 8%, in the past 7 days, 8% reported app-based work, and in the past 30 days, 11% reported that. Just because these numbers will be of interest to many people in this audience, we report here in terms of millions, the number of people who had app-based employment. So in the main job in the past 7 days, 1.4 million of Californians workers had that kind of employment. In terms of any job in the past 30 days, over 2 million did. I've highlighted 2 findings that may be of interest. In delivery workers, there were 840,000 of them who had that kind of work in the 30 days prior to interview. In terms of rideshare workers, approximately 300,000 had that kind of work in the 30 days prior to employment. And for those of us who lived in the Bay Area prior to the pandemic, when downtowns were busy, our downtown in San Francisco was said to have over 70,000 rideshare workers at some point in any 24-hour period. And these numbers reflect that high prevalence. So now I turn to each kind of work and whether it's more common in main or secondary jobs. And the bottom line is it's much more common in secondary jobs. These are percents, not numbers. So for independent self-employed workers, 34% of those in a second job reported they were independent contractors. And you see the numbers for either form of independent contracting. Among those who had second jobs, 45% of those were independent contractors. The same is true for any form of alternative employment, app-based works, and the combination. On the right side, with the dual bars, you see that 57% of workers in a second job reported that they were in some form of alternative work. 18% reported that they did app-based work in a second job, and 61% in either app-based job or any form of alternative work in their second job. Contingent work is also more common in second jobs by any definition of contingency. So I'll just focus on the right, the least conservative measure of contingency, where among those in second jobs, 15% of those were in contingent employment, and for main jobs, 10%. Still, and this is really important, we have enumerated the amount of work in second jobs and expanded the scope to the time frame to 30 days. And yet the vast majority of non-traditional work is performed as a main job. Among independent contractors, you see that 3 million of them do it in their main job and 1.7 in the secondary job. For any form of alternative employment, 2.2 million are doing it in their second job, while 5.4 million in their main. And similarly for app-based employment and contingent employment, the vast majority of work is done of this kind of work is done in the main job. So in terms of who claims this kinds of work, women were slightly more likely to have alternative employment. That's the second set of bars, but there was no substantial difference by gender in independent contracting, app-based work, or contingent work. There's also no consistent pattern by race or ethnicity in these kinds of employment, which was somewhat of a surprise to us. And Renee pointed out many of the anomalies that appear here in her work. So we repeat that message here. But we did find that older workers were more likely to be independent contractors or to have any form of alternative work. On the other hand, younger workers are much more likely to have app-based jobs or contingent employment. So there are major age differences in who has these kinds of work. Independent contracting, alternative employment, app-based employment, contingent employment are all much less common with higher levels of education. So it's not to say that nobody with a graduate degree is in contingent jobs or any of the other forms of employment, but they're much less likely to be. And in fact, just numerically, the number of people with these kinds of jobs with a high school education or less, or just some college or an AA degree, they're much more common among those kinds of people. Now I turn to some of the economic impacts that we measured. And we start by saying that large fractions of working age Californians report low individual earnings. The right side of the bar is 43% of California's workers reported annual earnings of less than $40,000. 26% had household incomes of less than $40,000 in the year prior to interview, and 19% were living at or below 125% of the federal poverty limit. We use that level because in California, the cost of living is so high as to render the regular 100% level of poverty a meaningless indicator of economic need. We also saw that the respondents reported 18% of working age Californians expect actual hardships in food, housing, or medical care in the next 2 months. 26% could not sustain an emergency expense of $400, and nearly 1/3 report difficulty living on their household income. So those are among all workers. We asked questions about benefit recipiency and of course, many Californians, 27%, had received COVID cash from the government, various levels of government in the year prior to interview. But in terms of the programs that exist in perpetuity, 7% of Californians employed in the year prior to interview used a food bank, and 11% received SNAP benefits. A smattering were on TANF or SSI, and 6% at some point in the prior year had received unemployment. Alternative workers and independent contractors are more likely to report low earnings, low household income, and poverty level income. The results on the left set of bars are for alternative versus not alternative work, and on the right side of the chart are independent contractors, one form of alternative employment, versus those who are not independent contractors. And you can see that there are substantial differences by these kinds of classifications. App-based and contingent workers are also more likely to report low earnings, low household income, and poverty level income. Alternative workers and independent contractors are more likely to expect financial hardship in the next 2 months. And so in the left, two sets of bars, we're comparing alternative and not alternative workers. And you can see, for instance, that 22% of alternative workers versus 16% of not alternative workers expect extreme financial hardship in the ensuing 2 months. And app-based and contingent workers are also more likely to experience financial distress. These are statistically significant estimates. On the left two sides, app workers versus those who aren't. On the right two side, contingent versus non-contingent employment. And I should point out in the prior slide and this slide, these results are adjusted probabilities of the reporting of these kinds of financial risks, and they're adjusted for the variables you see on the bottom of your screen. Alternative workers and independent contractors are more likely to be SNAP beneficiaries. They're also slightly more likely to have the other kinds of to be beneficiaries, the other programs. The TANF, that's not statistically significant, but the numbers are small, and it just misses being statistically significant for the use of a food bank. App-based workers are more likely to be both TANF and SNAP beneficiaries and to use food bank. Contingent workers are also more likely to be SNAP beneficiaries. Turning to health status, and again, this is complicated because we're not saying that the work here resulted in the health, because it's possible that people with health problems selected into these kinds of work. That's why we're doing a longitudinal survey. We will re-interview these people in another 18 months from now, and then we'll have greater certainty as to whether the work resulted later in changes in health. But for now, we have no strong evidence that alternative workers or independent contractors are in poorer health. App-based work is also not strongly associated with poor physical or mental health. However, looking at the bottom right set of bars, contingent workers are substantially more likely to report both. And you can see that in terms of poor mental health, about a third of contingent workers are reporting that versus 20% of those who aren't in contingent employment, with similar percentages in terms of physical health. These health measures come from the federal government's development of the PROMISE measures, which are designed to be standardized across surveys. So just to summarize the data, in terms of the yield from the survey features, much alternative, contingent, and app-based employment hidden if surveys only ask about the main job in the week prior to interview. So in terms of the different kinds of employment, the yield in the California Work and Health Survey increased by between 28 and 56%. The rates of these kinds of employments are higher in second jobs, but 70% or more of these kinds of work is in main jobs. Who does these kinds of work? Alternative, contingent, and app-based work is less common for those with higher levels of education. Alternative and contingent employment is more common among older workers, while app-based work is less common in this age group. Alternative, contingent, app-based work is associated with low personal earnings, low household income at or below 125% of the federal poverty level, and receipt of SNAP benefits. App-based work is also associated with the receipt of SSI and TANF benefits and use of food banks. It's also associated with expecting hardship in food, housing, or medical care in the next 2 months. Alternative employment and being an independent contractor was not associated with any health status measure. App-based work was also not associated with any health status measure, although there was a non-significant trend for app-based work to be associated with each measure. However, contingent employment was strongly associated with both poor physical health status and poor mental health status. And just to close with some acknowledgements, I'd like to thank the 4,014 Californians who participated in our survey, those whom Alicia LaFrance and Ima Varghese-Mack interviewed, did the key informants, cognitive interview, and pilot study, and then our colleagues who worked on this project in different parts of it. So with that, thank you very much.
Thank you, Ed. Thank you, Renee. Both of the presentations were so nice, so great. And Ed, particularly this data set, I think it can answer some of our questions that we always asked when we looked at BLS and QWL. As such, we are right on time and we don't see any questions being asked in the Q&A. It's kind of blank now. So anybody has any questions, just post it right now. Otherwise, we'll wrap it up. I have my some questions for Ed, but then we can always ask it later. I can ask one very easy, like this basic one is basically when you looked at the independent contractors and the self-employed. So it's the same question you asked in the survey, or is it a different question like BLS or QWL? They asked two separate questions.
We asked the same questions about after we categorized them as wage and salary independent contractors versus self-employed, we asked them the same questions. But the categorization questions obviously were different.
Sure.
We asked the self-employment question, and if somebody said they were self-employed, then they got into one loop. And if they weren't, we are asking a series of questions about people who reported not being self-employed. And as part of that battery, we asked if they were formally hired by the firm, et cetera.
Okay. There is one question, and that is, did you see the differences in those with or without college degrees?
Without what?
College degrees?
Yes. There were monotonic relationships in terms of the types of employment, inversely proportional. So if we could go back to my slide, but it's almost not necessary. It's a perfectly stepped relationship where although some people with college educations and beyond that, some graduate school are in all of these forms of employment, they're less likely to be in a step fashion comparing to those with a high school education or less, a BA, some college, but not a BA, and a graduate school.
Thank you. So I think we are right now out of time. So, and Deborah sends thanks for the answer. So we will wrap it up here, and thank you all for listening, and thanks Ed and Renee for sharing your research with us.